need it. The other second jeopardy, so these numbers got mucked up in my reformatting of the slide. 2, housing, cold, damp and overcrowded, and primary healthcare access. So let's just take through those briefly. So defining poverty in New Zealand, we're talking mainly about relative poverty, which is exclusion from the minimum acceptable way of life in one's own society because of inadequate resources. And that is things like expecting to eat every day, a nutritious diet, expecting to go to the doctor when you're sick. That's the kind of thing. You know, you could argue that there may be a few children living in absolute poverty in New Zealand without running water, electricity, adequate shelter. I don't know. You would know, but certainly relative poverty is what we normally talk about in New Zealand. As a paediatrician, how I define poverty and how I look at it is that you have insufficient income for these things that are essential to health. And these things that are essential to health is getting healthcare, which includes transport there, doctor's fees, prescription costs, hospital parking, etc. Having enough income for nutritious food, having adequate housing, not crowded, damp, cold or too costly, having adequate clothing, shoes, bedding, washing and drying facilities, having access to education, costs of transport, stationery, school donations, exam fees, school trips. And I haven't even mentioned luxuries like sports here. So if you're in poverty in New Zealand from a health perspective, it's because when you have all your income coming in, it isn't enough to cover all those things. You have to choose between necessities, and that's what poverty really is. So I'm going to go back to this tipping point, and when we look at the graph of that serious skin infections, and we put it on this graph here of poverty, we see that there was a tipping point for child poverty also at the same time, and so there's a strong correlation between what we're seeing for the admissions for serious skin infections and for the increase in child poverty. This is here's from 1980 up to 2010. Although these levels of child poverty here were unacceptably high, so 10 to 15%, they went up to double, and they're staying up nearly double. And that's, the first thing we should try and do is get our poverty rates back to this level here, because this is a shocking trajectory. There were lots of things that happened around this time here, and let's just look at those. Before we do, I'm going to look at this by ethnicity, and if you thought that was a bad picture, look at this one by ethnicity, and this doesn't go quite so far out here, but this is Europeans, and you see Europeans here, they've got a bad trajectory. But look at Māori here, and Pacific here. So everyone was clustered not too far apart here, and then spread out, increasing inequalities, with Māori and Pacific taking the brunt of it, but everybody affected. And we have an extraordinary paradox in New Zealand. Sorry, just before I go back to the people, there's a lot of discussion about who is in poverty, and of the kids in poverty, currently about half of them are in beneficiary families, but about half of them are in families where there's one adult working full-time in paid work. So we've got a problem of really low wages as well. But there is a focus on beneficiary families because they are often in even deeper poverty, and they form at least about half the group of children in poverty. So I'm going to look at those for a minute. So here we are. We've got here, I'm just going to take you through these graphs. Here we've got the population percent. We've got all people, which will include children, on an income-tested benefit. These are on market wages, and these are the elderly. You'll see that very different graphs here. So let's just take you through. These are the hardship tests. So this is severe hardship, significant hardship, some hardship, fairly comfortable, good, very good living conditions. So very bad, and this is the group here that we're incredibly concerned about. Now, if you look at the elderly over 65, they're all supported by a benefit too. They're supported by a superannuation benefit. And look how well they're doing. So we've got a real paradox in New Zealand. We've got benefits for the elderly that keep them out of poverty, and benefits for young families that are driving them into it. So we've got a double standard in New Zealand that we should examine closely. So there are several changes in policy adversely affecting incomes of low-income households with children around that 1991 time, around the whole period actually, but there's a lot of changes around 1991 in particular. But overall, we've got low wages and relatively high taxes for the low paid. Family income support's been inadequate for low-income families, been no indexing of family income support for 20 years from 1989 to 2008. In 1991, the universal family benefit was abolished. And for beneficiary families, in 1991, the benefits were cut by 21%, and they've not been restored relatively. So what was sort of an adequate benefit is just, 20%, 1%'s been knocked out of that, and no wonder people are struggling to make ends meet. And then this child tax credit, which was excluded, from which the beneficiary families were excluded. Jeopardy 2, housing. The two main issues, you'll be very familiar with this, I'm sure, in your area, are crowding and quality, cold and damp. And so crowding is driven by families having to double up because the accommodation is too expensive, and was uncovered as a major issue for our health with meningococcal epidemic, where it was found that you've got an increased risk of meningococcal disease, a marked increased risk as you got crowded. It was the chief risk factor for a meningococcal epidemic. So in New Zealand, in regard to the quality, 300,000 homes are wooden, uninsulated, damp and cold. And the problem is with that is that cold, damp houses can cause ill health, and they can cost a lot to heat, and that's unaffordable for low-income families. So when you look at that severe and significant hardship group, most of those people aren't heating their homes at all. So they're living in very cold, damp homes with no winter heating. It was only in 1978 that insulation for new housing became compulsory. We know that improving housing quality does help health. It's intuitive, but there's now been several New Zealand studies proving that point, and let's just quickly look at those. Since 2001, there's been these research programs, and they've shown that improving housing quality, which means insulating it and making it bigger if it needs to be, heating it with good heating, quality heating. So we've got improved self-rated health, self-reported wheezing, improved days off school and work, and fewer visits to GPs, a trend for fewer hospital admissions for respiratory conditions. Another study showed 37% lower rate of housing-related potentially avoidable hospitalisations, and the largest decrease was especially for respiratory conditions in children. And another study showed children with asthma significantly reduced their symptoms, days off school and healthcare visits. So there's immediate gains to be made by attending to housing. Jeopardy 3. I feel a bit in jeopardy here talking about this to primary healthcare people, but I will anyway. Primary healthcare access. So I just want to focus on 2 points here. And one is the cost of general practitioner visits for children in New Zealand as a whole. And I'm wanting to show you that in hours, which is 25% of the week, in most of the rest of the world with which we compare ourselves, it costs nothing to go to the doctor at any time in hours, whereas in New Zealand it's patchy. But it's often free now, and it's mostly free for children under 6 in hours. Out of hours is a huge problem, with us being really out of step with other parts of the world. And I'd like to congratulate Manaia PHO for the step you took, I think 2 years ago now, where you cut your after-hours fee to $5, and that was a New Zealand leading initiative, and I'd like to congratulate you for that. To carry on with a bit more information, our current Minister of Health obtained this information from the Labour government about the kinds of costs that people were incurring for under 6-year-olds. 50 clinics charge more than 15, 19 charge this even for those enrolled with the PHO, and 10 clinics charge at least 41. And we all know what $41 can buy for the family for food for the week, and they have to make a choice between these types of... It doesn't seem to make sense that you've got if we've got such a huge burden of acute infections in particular, that we have a cost between the child getting a need for a doctor and but not being able to afford that cost, given that for a low-income family that is an issue. I want to just comment on another issue, which I know you're doing very well up here, and in fact nationally we're doing very well now, but we've been very tardy on this nationally. We look back at New Zealand immunisation rates, which have now become a success story, which have not been for 2 decades. So if we go back to 1991-92, our average immunisation rate was 56%, quite shameful. And the target then set by the Ministry of Health was to have 95% by 2000. Let's go forward to 1999, it was up to 63%. They said they'd have it 90% by 2003, well it became 77.4 by 2005. And they said let's make it 95%, but didn't give a target. They introduced the National Immunisation Register, that didn't change anything. But it was only when the Minister of Health, I think, correct me if I'm wrong, said you've just got to do this, we've just got to do this, and we are. Suddenly we've got 90% by July 2011, and the target's going to get higher and it's going to get tougher, like immunisations on time. So we actually decide, it's taken us a long time to decide to do something about immunisations, but immunisations are a really good way of reducing disparities, and we're obviously having trouble doing it other ways, so this is one thing we can do to reduce disparities. And really, internationally, immunisation rates are thought of and considered as a measure of the national commitment to primary health care for all children. So it's fantastic that we're now doing so well, and I congratulate those of you who have heard some fantastic stories up here. So it's just great that that's coming along so well now around New Zealand. So I'm not going to give you a whole lot of recommendations. I'm just saying that the way forward is to prioritise our children. They're our future. We need to adhere to our, if we adhere to our national rights commitments, we'll get it right. And I think we need to work together, and that's what we're doing here tonight. We need to work together towards eliminating disparities. Because the future of New Zealand depends on the well-being of every child. Ahakoa he te pōnamo. Thank you.
Unuhia te rito te hara ke keia te ko mako e ko whakatairangi te arere ki uta rere ki tai nau e ki mai he aha te mea nui maku e ki atu He tangata